Welcome back. We are going to talk about some basic type of questions you're going to be exposed to through school. So your instructors, as they make tests, are going to make tests around recall, application, and analysis questions because that's what you're going to see in the TMC. But we can break those three categories down into types of questions. And so that's what I want to talk to you today a little bit about, are some common types of questions that we implement. All right, so we write questions that deal with priority. All right, so when we write a priority question, when you're taking the test, you're going to want to look for keywords. For example, first, initially, best. What's the priority? What's the safest? What's the most efficient? What is the least safe? So these keywords will be keywords that set you up for getting the question right. So these type of questions are typically called priority questions. We also like to ask questions that are sequence questions because a lot of what we do as respiratory therapists revolves around a correct sequence of events. If we suction somebody, there's a correct order of the way we do that. When we stick for an ABG, there is a correct order of how we do that. So we ask for a lot of sequence type questions. So keywords there are before, after, during, next. All right. We may ask negative polarity questions. This cracks me up. As an educator, I made a great negative polarity question. That makes me sound really smart, right? Basically, it just means I know how to use words like not and except in a question. All right. But these are what some people think are tricky questions. And it's not that they're tricky questions. It's that as a student, especially if you are a fast test taker, your brain is not reading every single word. Your brain is only picking up keywords. And oftentimes, if you're a fast test taker, your brain is leaving out one of the most important keywords that is at the end of a sentence, like the word except. All of the following are indications of oxygen therapy, except. And if you don't read that one keyword, you're probably going to miss that question. And so these are very common type questions, except and not type questions, because people don't read that one word that makes all the difference in the world. So watch out for those. Not, accept, contraindicated, unacceptable, avoid. Those are negative polarity questions. Absolutes. Absolutes are keywords like always and never. What is one of the things you always want to do with a certain procedure? So several things may be things that need to be done, but there's one in there that will always be done. So pay attention to that. And then verbal associations are types of questions that the stem of the question itself, has a very particular word you need to pay attention to. And if that word is found in the answer, or a word that's very similar is found in the answer, oftentimes that's the answer. So I just want to roll through 5 questions that deal with this so you can see what they look like. All right, so a priority question. Now here's where I tell you, if you're in a school that you have a paper test in front of you, I would say circle or underline the key phrases. If your institution gives you the test and it's in electronic format, that's what you're going to do with taking a TMC question. I would tell you, you're going to have a piece of paper and a pencil. I would write down that keyword, which makes you focus on it, okay? A 56-year-old male patient previously diagnosed with COPD enters the ED with shortness of breath, sinus tachycardia, cyanosis, and pursed-lip breathing. His SpO2 is 85%. Which of the following should be done first? And I was really nice when I wrote this test question because I capitalized it, I bolded it, I put it in italics, and I underlined it. So as an instructor, I start out school doing that, emphasizing that key word. And as my students transition through the program, I don't emphasize it anymore. Like when I write the question now for my second year students, I'm not going to do it like this. I'm just going to write the word first. It's going to look like everybody else, all the other words, and I expect my students to pick up on that on their own. But what do we do first? So when we look at this question, the patient's short of breath. They're having problems breathing. they have an elevated heart rate, and they're cyanotic. All three of those things point to hypoxemia with some tissue hypoxia, that blue discoloration of the skin. Pursed lip breathing, this just indicates the patient's giving themselves a prolonged expiratory phase. That probably has more to do with the disease process than hypoxemia. His SpO2, so you put a pulse ox on the finger, that's what that P stands for. The pulse ox is 85%. That's low. That indicates hypoxemia. That means the P little AO2 is about the lower to mid 50s. Okay, this person is hypoxemic. So, which of the following should be done first? Everything here tells me we've got some hypoxemia. If we have hypoxemia, we need to add some oxygen. Okay, so this is the answer. That should be what's done first. And I'm not saying these other things don't need to be done, but given the information I have in my scenario, I need to give them a little bit of oxygen first. Then I probably need to listen to them, and if they are wheezing, then I'd probably give them a beta-adrenergic bronchodilator. It's going to be a good idea to get a chest x-ray so we can see what's going on in the chest, and getting blood for a CBC, because a lot of times we need to evaluate the hemoglobin level, we need to see if they have an infection, and a CBC will do that. But the first thing needs to be done to treat these symptoms of hypoxemia. Okay. Sequence questions, okay? Before performing endotracheal suctioning, okay, what type of suctioning? Endotracheal suctioning, down an ET tube on a patient, which of the following must be done? Hyperoxygenate, hyperventilate, insert a nasopharyngeal airway, and place the patient in a supine position. So I'm going to incorporate some test-taking strategies, and I'm going to incorporate two different ones here. If you don't know right off the bat which one this is, I'd tell you to eliminate some distractors. So if you've got a little bit of a comprehension of an airway and suctioning, we don't want to insert a nasopharyngeal airway if we're suctioning down an ET tube. That doesn't make sense. That's a distractor. Also, we don't suction with the intent of them being in a supine position. We don't go in there and say, oh, let's suction, let's lay the person flat on their back. All right, those are distractors. All right, got a 50-50 chance. Also, remember I told you about mirror images, polar opposites, hyperoxygenate versus hyperventilate. Oxygenate means we need to give extra oxygen. Hyperventilate means we need to blow the CO2 off the patient. Those are two extremes. And because they're two polar opposites, it's probably going to be one of the two. And here's the deal. If we're suctioning somebody, we're literally sucking all the secretions out of their lungs, but we're sucking oxygen out too. So we need to hyperoxygenate that patient right at the beginning so that we can offset any type of hypoxemia. So that's a sequence question. Negative polarity. Okay, this is the not or the accept questions. All of the following are indications for oxygen therapy except. Now, if you are a fast test taker and I didn't bold, italicize, put it all in caps and highlighted it, see how it's on the second line? We do that on purpose because your brain stops here and what you've really seen, indication oxygen therapy. And if you don't read that except, you go right into the answers looking for reasons to put them on oxygen. Okay, so this is the except, meaning all of these are reasons to put somebody on oxygen except one of them. All right, so then start going down the list. A, the PaCO2 of 52. CO2 has to do with ventilation, not oxygenation. All right, so that's probably the exception. Let's just check the rest of them, all right? If a person has a PaO2 of 55, that's moderate hypoxemia. That person needs oxygen. If their pulse ox, you put a pulse ox on them and their saturation reads 88%, that means they have hypoxemia. That is an indication for oxygen. If they are tachycardia and tachypnic, the body's first responses to hypoxemia is to increase heart rate and increase respiratory rate. It happens. So these are indications for oxygen. So the only one that is not an indication would be that exception. That is your exception. I started out one way and labeling it, so B, C, and D are reasons for, but CO2 of 52, we don't look at the CO2 to determine if a patient needs oxygen. All right, so these are negative polarities. Watch out for those key words. Okay, me, now with my second year students, I just roll that except in there. I don't underline it. I don't put it in capital letters. I don't bold highlight it. I just write it as a regular word because I expect my second years to be skilled enough to pick up on that. Read every single word. Absolutes. Remember, those words are always and never. Which of the following should always, in every single case, always be done after? Oop, I got a little sequencing in here also, okay? And absolutely always has to be done after puncturing the radial artery. All right? So, check for collateral circulation. Yeah, that needs to be done, but that's before the puncture, and we're looking for after, so the sequence matters. That's not an option. Placing the sample on ice. Now remember, this is an absolute. Always. Do you always place the sample on ice? And the answer is no. If you're doing point of care testing and that blood gas machine is right there beside you, that point of care testing, the iStat is right there, we don't ice those samples. So we do not always place the sample on ice. But after you've stuck, are you holding pressure for at least 5 minutes? Absolutely you are. In every single instance you are. At least 5 minutes, and even longer if they continue to bleed. So this is the absolute thing that always needs to be done. Now, if you see yourself wanting to answer D, because this is what you're seeing in clinical practice, I'm going to tell you, you cannot test the way you see in clinical practice. NBRC test-taking standpoints, we never put a pressure bandage on. And if that's what you're seeing in clinical practice, I'm not going to say anything at all about that other than don't test that way because you will get it wrong. So that's not an option. But the thing that we always do after puncturing for a radial artery is to hold pressure for at least 5 minutes. Okay, so those are your absolutes. And then verbal associations, looking for like or similar words or the same word. All right, so which of the following could be responsible for acute alveolar hypoventilation? And if you're just starting school and you don't know what blood gas or you don't know blood gases yet, you may not have a clue what an acute alveolar hypoventilation means. If you are in school and you've gone through blood gases and you've learned this terminology, you know this means an elevated CO2 and a decreased pH. All right. But if you're just starting and you don't know what that is, I would tell you start looking for similar words. So we have the word hypoventilation there and the word hypoventilation there. So if you're just guessing because you don't know, and there's not an option to increase flow, use your verbal associations. And this is absolutely right because there is a concept, a theory that in certain COPD patients, if you apply too much oxygen, they will hypoventilate. So that's the correct one out of these choices because anxiety causes hyperventilation. Cardiac stimulants really have more to do with the heart than the lung. And then a diabetic ketoacidosis will cause the patient to increase their respiratory rate, which will cause hyperventilation. All right, so those verbal associations sometimes are a good way to increase your chances of getting a question correct. All right, and I want to deal with this because a lot of students, when you first enter school, you may encounter something called a multiple choice question. And it looks like this. All right, and there's a lot of busyness going on. So a multiple choice question, you have the question itself, then you have 4 options, but more than one of these options may be right. So here's how you would approach a multiple choice question if it's laid out vertically for you. And what I mean by vertically is you're looking at everything from an up and down standpoint. All right, which of the following would indicate a need for oxygen therapy? Well, if somebody's saturations, the hemoglobin is less than 90% saturated with oxygen, this would be a reason to put them on oxygen. This would be a need for oxygen therapy. CO2 has nothing to do with oxygenation. That's ventilation. This is not an option. Okay. Now, let me also show you a test taking tip. I know 2 is not an option. And so when I look down here to find the right options, all right, I'm going to roll through it right, and then I'm going to show you down here and incorporate some test taking skills. A PaO2 of less than 60, that's definitely going to be a reason for oxygen. And if a person's tachycardic and tachypnic, we already talked about that a while ago, that's an indication. So the answer is 1, 3, and 4. All right. And if you know that answer just straight off the bat, you can come down and say, okay, the answer is 1, 3, and 4. I need to find 1, 3, and 4. That's C. Okay. But let's say you're just coming into RT school and you don't really know for sure about some of these things, or maybe you don't remember some of these things, but as you're looking through here, you do know that CO2 has nothing to do with oxygenation. That's about ventilation. So 2 is not going to be in the answer. Here's a test taking strategy. Come down to your answers. If you know 2 cannot be in the answer, that one has 2. Well, it's not A. That one has 2. It's not B. That one has 2. It's not D. And see how you know that the answer is C. And you've got the right answer, not by knowing what the right answer was straight on, but knowing what was incorrect. So sometimes you can weed things out just by things you know aren't going to be a correct option. All right, so this is a multiple. And a lot of people say, well, Tanya, there are no multiples on the test anymore. You will not see a TMC question like this. And that's probably true since the new matrix changed. You don't see them like this. But I tell people, yeah, it's wrong to say there are no multiple because they are now in a horizontal format instead of a vertical format. So this is the absolute same question we just had. Which of the following would indicate a need for oxygen therapy? And so while you don't have those answers stacked up vertically, you do have them all horizontally. And I think these are harder for me. And maybe it's just because I grew up with them multiple going vertically, but these are much more difficult for me because a lot of people, when they approach these, want to look at each and everything. And when I do this, that's a lot of stuff for my brain to want to look at. So what I try to do is eliminate the noise. I get rid of a distractor. So I'm going to choose one thing. Is it the SaO2? Is it CO2? Is it the PO2? I'm going to choose one thing, and I'm going to eliminate with this one thing. And so here it is again, giving me a CO2 greater than 45. Well, a CO2 tells us nothing about oxygenation. Tells about ventilation. So I know CO2 is not going to be an indicator for oxygen therapy. Well, it's not there. It's not, there it is. Okay, so A, B, and D are not correct, but C is. But go ahead and check it all. A SAT less than 90 indicates hypoxia. Yep, it does. A PaO2 less than 60. Yep, that's moderate hypoxemia. And then an increased heart rate, that's one of the body's first responses. So there are still multiple choice questions. They are just done in a horizontal format, or sometimes they do them in a chart format. But you will still be picking multiple responses with one answer on the TMC. Okay, so that's all I have for you today. Be looking for a part 2 because there's a lot of other different type of test questions that we use, and I want to expose you to those too. But this gets you started. So I hope you found it beneficial. Have a great day.